C-section is major abdominal surgery. I could barely keep my eyes open. Nobody tells you this. Your body is going to feel shattered and it didn't smell right. In today's video, I really want to talk a lot about what to actually expect when you're having a C-section. So I thought this will be a really good guide for any of you who might be first-time moms or expecting, even if you've had babies before but never had a C-section. This video is perfect for you. Not an expert, but speaking from personal experience, I will walk you through from 24 hours to 48 hours to 6 weeks, 12 weeks to 1 year. So let's jump right into it. In the first 24 hours after having a C-section, you pretty much are going to be in the hospital. You've probably had a spinal block or you've had an epidural. It's very rare that they'll give you a general anesthetic, but in some emergency cases that might occur. So if you've had a spinal block, which I have had 2 of them now, they inject into your spinal area and that helps to numb you from chest down. Is it painful? Yeah, but it is just a quick sting when the needle goes in and cause like a warm sensation for your body, and then you end up feeling nothing. In the first 24 hours, you will feel pain once that anesthetic wears off. Speaking from experience, I felt a lot of pain in my abdominal and where the incision was. That is because there's been a lot of pulling, tugging, and of course your placenta has now been removed. And that is almost like an open wound on the inside of you. So your abdominal area is extremely sore. There will be a lot of discomfort. And of course, you will experience bleeding from the vaginal area, and that is very normal. So initially in the 21st 24 hours, it will be a bit more of heavier bleeding. You shouldn't really ever be seeing clots or clumps of things like that coming out based on what my midwife had explained to me. So if there's anything like that, I would certainly flag it. And whilst you're in hospital, they're going to be asking you all those kind of questions. Generally, it should be a bleed that looks a bit like having a period, but it will be a bit heavier in those first 24 to 48 hours, and gradually it should taper off over the next few weeks until it pretty much just stops. It will hurt to sit, it will hurt to laugh, it will hurt to cough, it will hurt to sneeze. Nobody tells you this. Honestly speaking, that is going to feel like your stitches might burst open. Make sure you have a pillow. You hold that pillow tightly against your incision and stomach when you cough, when you sneeze, or when you laugh. It is excruciatingly painful to try and twist when you've just had a C-section. So please use the bell and ring the midwife to come and lift your baby for you if you are feeling like, I cannot do this. Or if your husband or partner or family member's there to support you, that is their new job. Last thing about pain, take the pain medication. I had actually initially said to them, I don't want any pain medication. I'm just going to ride it through and, I'll be fine. Oh, did I change my mind? I think they offered me morphine. It's a form of morphine, the tablets that was on. So when you're in hospital, it's likely that you'll have morphine basically as your pain management, and then they'll give you ibuprofen and paracetamol. And it sounds like a lot of medication, but honestly, that's how painful a C-section is. So they normally kind of just keep your pain management topped up so that you're never hours without some form of pain management going through your system. When you go home after maybe say 48 hours or so, they will not give you morphine. What they will give you is normally dihydrocodeine. And I know that in the UK, that is the pain relief that they normally send you home with, as well as of course recommending paracetamol and ibuprofen. You will probably feel very groggy and a little bit out of it. I certainly woke up feeling just like I'd been hit by a truck or by a bus. Just remember feeling like, oh my gosh, I could barely keep my eyes open. I felt really sick, which is very common for me, and I was given a lot of anti-sickness meds. The foggy head, the extreme tiredness. Whether you've had to push before having that baby and then had to have an emergency C-section, or you've just gone straight and had a C-section, because you've got so much drugs pumping through you, on top of all the hormonal changes that are going on, your body is going to feel shattered. There will be a little bit more separation from you and baby in that first hour. That is one of the downside a little bit to a C-section, because the doctors are going to be having to sew you up. So they will take baby out and put baby like normally head to head. And that is still a lovely moment, because you're going to be able to kiss baby, snuggle cheek to cheek, face to face. And you might even be able, if you have the strength and ability, to hold baby with one hand and just get some kisses and cuddles in as you can. They're also going to want to check baby over. And if there are any particular complications or anything that happens with baby, then they're going to maybe have to take baby away, just sort those things out, and then bring baby back to you. It can just be a few minutes, and sometimes it can be a little bit longer. You can't do much. You are going to be taking like baby steps, like you've just learned to walk again. You're going to feel a lot of pain trying to get out of bed. Within the first 24 to 48 hours, they're going to be asking you, can you get up? Time to get moving. Get your stockings on. The stockings basically to avoid blood clots forming in your legs. You definitely want to keep those on. But you're also going to be expected to try and use the toilet once the catheter is taken out, and you will have a catheter put in when you have a C-section. It's just something that has to happen. They will probably try and take the catheter out within that window of 24 hours. After that, you will be expected to try your best to get that first wee out and you get that first poop out. Let's just be honest, it can be really scary taking your first poop after a C-section. They will give you stool softeners, and I would recommend you stay taking those things for weeks. Don't just take in the first 24 to 48 hours. Continue taking your stool softeners all the way through the first at least 2 to 3 to 4 weeks. And that is just so that you don't end up constipated or straining in that region. Having a C-section does not mean you cannot breastfeed. However, it does mean that you might experience a little bit more discomfort when baby is placed on your abdominal region and onto your breast for the first time or for the first few times. Use a nice little soft pillow, maybe to lay baby on top of your tummy area or under your arm if that's going to be a little bit more comfortable. But also make sure that you test out breastfeeding positions that work for you. I struggled to breastfeed with my first baby boy, and that was because they said I had flat nipples. I never even heard of that thing. And then with this baby, my nipples were very erect, very there, and the midwives were like, "You've got great nipples, get it in his mouth." So honestly speaking, I did not have enough education around positions and ways to get baby to latch a lot better whilst being in this much pain with a C-section. So I would just recommend that you focus your time on actually learning a bit more about breastfeeding and actually practicing positions. Use a teddy. I was actually going to bring a teddy for this video, but I forgot it and it's in my little boy's room. Now I'm going to insert a really great YouTuber called Life with Latoya. Oh my gosh, I might be getting that wrong, but I'm going to insert it here. She has a brilliant breastfeeding video that breaks down everything you will need after giving birth, if you're going to be doing breastfeeding as well as pumping. I found that video so helpful. But also I'm going to link another video where they showed you how to get baby to latch better. I use that video, another YouTuber, and I will link it all in the description box below. There should be breastfeeding support in the hospital. Definitely tap into them as well as the midwives. I would literally just grab any midwife who is willing to give you about half an hour to sit with you and to really just help you get that latch on. I really still struggle with the latch and have mainly gone to bottle feeding, but I will probably do another video talking about breastfeeding in as much detail of what to expect, what the realities of that look like. Breastfeeding is its job in itself. So if you can have somebody who's like, hey, I'm going to be the bottle washer or I'm going to be the breast pump washer, really just focus on healing and restoring and nourishing your body back to optimal health. Let us talk incision. There are certain things you need to make sure you do to keep your incision safe, clean, and hopefully not infected. Now, as a C-section mama of 2, my first C-section, beautiful. Cut, sewn up beautifully, healed wonderfully, no concerns. My second C-section, ooh, when I tell you, from the moment the anesthetic wore off, I knew there was a problem. And this is what experience with C-sections will do. Please use the comments below and tell me if you've had multiple C-sections, if you know, oh yeah, you could tell there was something up with your second one or your third one. Just use the comments below, share some encouragement, advice, or tips for any mums out there who might be going through a C-section or about to have one. The stitches that they sew you up with are dissolvable. So generally speaking, you don't need to worry about any stitches being removed or anything like that, because they will dissolve into your skin. But just dab your incision area. Do not rub it and, do anything like that. Just dab dry and let it be. If you have an overhang with your tummy area, they advise you to kind of lift your tummy area and make sure you allow air there to dry it and make sure it doesn't get infected. Well, I was doing all of those things and I still had a particular scent. And I was telling the midwife, like, no, something's really not right. I finally got them to do a swab, and it took ages for them to come back and tell me, yes, actually, you've got an infection with your wound, which I already knew, because something in you, when you become a mum, your body just starts communicating like something's wrong in this region, something doesn't feel right. You have to be able to trust your gut. Even if you don't have a medical degree, your body and you know each other, and your body will communicate to you. So make sure you are paying attention to anything that feels off for you. Even if you don't have the language to name it, you're just like, look, something down there doesn't feel right. You need to have another look. I need a second opinion, and keep going on, because I had to do that. Even though I couldn't see down there, I couldn't see the incision, but I could feel that things just did not feel right and it didn't smell right. And of course, I was bang on the money. And lo and behold, a few weeks later, they finally saw that my stitches were not dissolving fully at the end of where my C-section was tied off. Now, my experience is a very rare case of somebody just really missing the mark with how they tied off my C-section, because in my first experience of it, I did not have that experience. So I'm not saying this or sharing this to put you off. I'm just saying, when you feel like something doesn't feel right, make sure you speak up. Part of your tummy, the bottom area closest to your incision, the nerves have been cut there, so they're going to be trying to regrow and reconnect, and that will cause that area to feel just very numb and very weird. And that is very normal, because the nerves have obviously been severed. You will just have a very different sensation there. That can last not just 1, 2, 3 weeks. That can actually last for like even up to a year or so. And I certainly would say about a year before it felt like that area had really healed in a way that didn't feel like it was still numb and very sensitive. But that is very common. You can end up with a kind of like overhang because of the way it's sewn. It can cause your tummy to kind of have that fleshy part at the bottom of your tummy, just kind of create an overhang. It doesn't happen to everyone, but it is a common kind of side effect, I think, of a C-section. It doesn't have to remain, because I've seen a lovely lady called Grow with Jo, whose exercises I do. She had C-sections and she has managed to really flatten out that overhang region of her C-section. Once you are leaving, depending on your age, you will have to go on blood thinners. Because of my age and being 37, that was the reason I had to do 6 weeks of blood thinners. Now, I think as you go up in age, that actually may change. So you may have to have a longer number of weeks. Being a bit younger, I didn't have to have them with my first, but obviously being 37 this time, I did. Which meant that I had to go home, and every single evening I had to inject my tummy area with blood thinners, and that was really painful. It was really uncomfortable for me to have to like actually inject myself with this long needle, and I just did not enjoy it at all. But I also kept in mind that if I don't do this and I end up with a blood clot, I would be really hard on myself, basically. So I just made that commitment that though I hate doing this, though it hurts, I'm going to keep doing it because I do not want to end up with a blood clot. If you're here in the UK, you will have the community midwives who will come out and see you at home if you are poorly or really just unable to attend their community hub. Then they will come to your home. So I'm not sure how it works in the US, but I know in the UK, 24 hours after we were discharged, the community midwives came out to my home and they looked at my incision, they weighed baby, they did all those regular checks, and they even did a swab again because I had told them I'm still not happy with how the incision and what I'm experiencing down below. And on day 3 of being home, they came out again and saw me and baby and had another look at the incision and did the checks. And then of course on day 10, I think, or day 7, they come out again. But this time I was well enough to actually travel and go and see them at their hub, which was really good. Do not lift anything heavier than your little newborn baby. I have a toddler who is a very active and wonderful little boy, but when I tell you to try and lift him after I had a C-section 11 weeks ago, it was not possible. You just don't have the strength, and it's just not advisable because you can actually end up doing a lot of damage to your incision potentially if you are lifting heavy objects. Now, I know that in reality, a lot of us are already moms, or we just haven't got the luxury of not lifting some things heavier than our newborns in those first 6 weeks. So if you have a husband, a partner, family members, friends, anyone, it is time to delegate and tell them, okay, this is what I need you to do. This is what I'd like you to do. And that's your new job for 6 weeks. How soon should you exercise after having a C-section? Well, good question. I would say don't do any extenuous exercise routines and things like that until after 6 weeks. I would say walking will be a safe and suitable thing to do. Not like hiking and, these long terrain walks. I'm talking about just a gentle walk with the stroller, with your baby, nothing over the top, because your body truly needs time to heal. Good healthy options for food would be also advisable so that you can just restore your body to its best optimal health. Soups are really good, like chicken broth and lots of water, especially if you're breastfeeding, because when you're breastfeeding, you're going to be extra hungry because you are pumping and producing all that lovely, gorgeous milk. Drink lots as well, because that will help move the fluid through and out of your body. Ask someone to focus on just making you those first meals in those first few weeks. That would be a really good form of support, I think, for you if you've just had a C-section. Can you use a warm compress or a hot water bottle on your tummy area after a C-section? Yes, I did. I personally found it really helpful. Of course, you need to be mindful not to put in a hot water bottle directly on your incision, so make sure it's obviously covered. You might want to just put it on top of a jumper that you've got on or something. But I did, because that warm sensation just helped to alleviate some of the pain and discomfort I was in. Something that is quite common after a C-section delivery is your blood pressure sometimes becoming a little bit unstable. And that can be that sometimes your blood pressure becomes a little bit higher, or it can actually drop. It is just something I'm just mentioning because I know with a lot of C-section mums, their blood pressure seems to be something that kind of takes off after having baby. And I'm not saying that everyone who has a C-section ends up with high blood pressure or low blood pressure or anything, but it is a common thing that I have found amongst other women and other mummies that I know who've had C-sections, and it requires a bit of medication just to stabilize it for a number of weeks, and then after that everything returns to normal. So touch wood, I have been blood pressure medication free for a number of weeks now, and my blood pressure has stabilized and I'm no longer on any medication for it. So just want to remind you that, sometimes these things just happen for a short season and then things get back to normal. I've had all sorts of things said about women who go for C-sections, and honestly speaking, people who've never had a C-section should never speak on it, because it is such a huge form of surgery to go through, and whatever way you deliver your baby is the way that it has to happen for that baby hopefully to have arrived here safely. And that's the most important thing, I think, rather than people berating us as women who've ended up having to have C-sections for various reasons. And even if you opted for a C-section over vaginal birth, that doesn't make your birthing experience any less than a lady who's gone for a vaginal birth. So I just want to reassure you that don't let anyone, make you feel rubbish for opting or having to go down the route of a C-section. So if you've enjoyed this C-section recovery video, then please do not miss out on the next video I'm about to release, which is the entire postpartum process. Now, if it's not already here in the box above, then it means that I'm currently creating it. So look out for it next week. Be sure to hit that subscribe button, and I'll see you in the next one. And if you know any C-section mamas out there who have currently just had a C-section or might be going forward for a C-section and have no idea what to expect, then please do share this video so that other mamas just like us can actually be in the know about what they can actually expect potentially to happen. And if you have any advice or things that have happened to you, share it in the comments below and let us all have a good chit chat about our different experiences and encourage another mum who might be on her journey of recovering from a C-section.